B. Row B, seat 1. How you doing?
Hi, how are you?
Doing pretty good. Oh, sure. Hello, ladies and gentlemen, and welcome aboard Flight 2215 all the way to Chapel Hill, North Carolina. I am one of your flight attendants. If you look, there are bathrooms located in the front and in the back on both sides. In case of an emergency landing, please find the nearest exit. The lights will light up on the floor and you can exit onto either wing or in the front and again in the back. Please fasten your seatbelts when that seatbelt sign comes on. In case there is an emergency landing, these will pop down, which is your oxygen mask. Please place them over your nose and your mouth and take deep breaths to keep you oxygenated. We will be passing out snacks and drinks once we get mid-flight and the fasten your seatbelt sign has come off. Please always listen to us, and if you have any questions, please let us know. Thank you and have a great flight. My name's Betty Sue. What's yours?
Hi, I'm Sierra Bishop.
Oh, nice. What do you do?
I'm a professional softball player, and I'm actually in school too.
Oh, well, nice to meet you. What you in school for?
Physical therapy?
Oh, okay. That's good. You know what? I'm on my way to go see a physical therapist. Yeah. Went to the doctor. He told me I gotta go see a physical therapist for my neck pains and stiffness and stuff, you know. I'm gonna go see this guy over in North Carolina. That's where I'm from. Can't tell. Yeah, his name's like McDonald's, McMike, yeah.
Oh.
That's his name. I'm gonna go see him.
Mm-hmm.
Maybe you think you can help me with my problems?
Well, what's going on?
Okay. Well, I'm 63, so I'm getting kind of old and up in there in age, you know. But my neck's been hurting. That's what my doctor said. I got some hypertension, hyperlipidemia, yeah.
Oh.
Yeah, and I had a hiatal surgery for a hernia. I had that done. And yeah, well, after that, about like a month later, I started getting kind of dizzy. I had some vertigo symptoms and stuff. It happened when I would lay down and when I sat up in bed. So I went to the doctor because I ain't like feeling dizzy. I don't like throwing nothing, you know. So I was at the doctor and they told me I had BPPV. BPPV, yeah, that's what I had. So I went to them and, you know, they gave me some medicine for it. And a little bit later, I'm still having some problems. It got kind of bad. See, I don't like turning my head to the right because that's when my symptoms get good. So that's why I like sitting in this seat so I can talk to the person beside me right here. So, yeah, so it's been about 5 months and I went back to the doctor. You know, I got some stiffness in my neck and soreness. I get a headache, you know, on the right side. Yeah, so it's been about 5 months actually. And it's gotten worse when I go to the right. I get a headache. I get these black spots sometimes. And whew, at my age, you don't need no other problems. They made me go do a hearing test. And I have some abnormal hearing loss, or like not equal in both ears, but still equal. So I don't know. I guess physical therapy, y'all can help fix my tightness and maybe help with my headache and stuff, you know?
What do you do that brings on the black spots? Is it a certain way you're sleeping or?
Yeah, I mean, it's just when I lay down and when I look to the right, sometimes I get them. Yeah, but so I try not to do that. But I don't know, it's just tightness and just certain head movements get them.
So do you mind if I try something? Maybe see where you are with your neck pain?
Yeah, sure, help me out. That'd be great.
Okay. Now I'm just a student, so I'm not perfect at this, but can you recline your seat back?
Yeah. Whoa, these things fancy now.
Yeah.
Make them like they used to.
Good. Now look over at me.
Okay.
Just rotate that head. Good. Keep looking at me. Good. You feel any change in symptoms?
No, everything seems alright.
Okay. You hold this for 30 seconds.
Okay, I will.
And you said when you get symptoms, it's like black spots?
Yeah, it's black spots. Feel kind of dizzy and stuff. But my vision kind of changes a little bit. It's a
Okay.
little weird.
Keep your head there. Let me come to this side. And we rotate this way. Keep your eyes open.
Oh, okay. I know, it makes me want to take a nap.
Yeah, we haven't heard the upright position thing yet.
Yeah. Yeah, we're just still in the air. About halfway there, according to my calculations.
Oh,
Yeah, my grandson's gonna come pick me up.
that's so sweet.
Yeah, he's a cute guy.
Do you have a lot of family in North Carolina?
Yeah, about everybody lives there. I moved down to Florida, you know, it gets so cold up there. I like to be warm.
Okay, there's just one more.
Okay.
Where are you gonna lean back?
Okay.
Any change in your symptoms?
Oh yeah, them black spots coming up again. Oh golly gee.
Okay. I really think we should get you to a hospital when we land.
Okay, alright.
Yeah. Oh my goodness, the engine's smoking.
Oh no.
There's something they're not telling us. Seatbelt, we gotta get up. I think we're somewhere in the woods. We've got to get off before this plane explodes. Okay, let me help you.
Okay. Oh, yeah. Oh, my purse. My purse. Okay. Oh, yeah. You get me
Crawl
over.
through this window right here.
Okay.
Alright, well, all those ambulances really had to get those emergent cases to the hospital. Those people really needed help. So I'm going to drive us to the hospital. I know you need to be seen. And, gosh, I can't even keep hold of this steering wheel.
That arm was mighty big. Whew.
I have chronic exertional compartment syndrome, and my muscles swell up to 20% more than what they should
Oh, gracious.
when I exert myself. So when I pitch for softball, this comes on. I lose feeling in my arm to my hand. I can't activate the muscles. I'm getting a fascial release today. They're going to go through, cut the fascia open to provide some space in my forearm. They've got to do it on the volar side specifically, and hopefully that prevents this from happening again, because when it first started happening, it came on, the pain would come and go because it was based on exertion. So if I'd pitch a lot, it would come on, but then it would kind of dissipate, and so there wasn't really a good way to see what was causing it, because it was just short term, on and off again. And now that I've been dealing with it for months and months, it's pretty obvious that when I exert, the increased blood flow, increased metabolic activity, everything causes that to just swell up, and there's no room left in the compartment. So that's what's going on.
Oh gosh.
And so I saw a physical therapist for about 4 weeks for this. I know you said you're trying a physical therapist out, and they can be great, but unfortunately there wasn't much a PT could do to change my pain. After 4 weeks of trying different things, my PT recommended that he discharge me from therapy and actually contacted an orthopedic for me to be referred to. So he sent the email to a colleague of his and said, I have a patient that isn't responding to PT. I think further diagnostic testing would be appropriate. And then he included the patient presentation. So how I was presenting in clinic and the pain that I was experiencing, all my symptoms, that was very important. So because of my patient presentation, that was a very important diagnostic tool to get to where we are. So I went to an orthopedic. They followed up with 2 more tests. I did a pre and post MRI. A regular MRI doesn't show what's going on. And then a pre and post compartment pressure test. So after ruling out that it was nerve entrapment, peripheral neuropathy, muscular conditions, they ruled out everything else at PT. Now they had to do these diagnostic tests in an orthopedics clinic and got the MRI done. So now they know that it's chronic exertional compartment syndrome. Non-emergent, they have me scheduled for this surgery. It's just an outpatient procedure. So I'm going today to get that done. So I guess when we get to the hospital, we'll see how they're doing with all these crazy emergent cases from the plane crash.
Yeah, because I didn't get injured, but you said my stuff's an emergency, right?
Yeah, I think it requires immediate attention.
Okay.
So we'll get you to the hospital, we'll get you seen, and I'll be a few doors down.
Yeah, thank you for calling the doctor ahead for me, you know, after we landed and stuff, just so they knew what was happening, what your positive results were. Even though you're a student, I think they trust you, you know.
Yeah. We'll get you taken care of.
Hopefully they'll get you taken care of or something.
Yeah, your vertebral artery is a big concern.
Yeah.
And, that could be causing some insufficient blood flow to your brain.
Right.
So just don't extend your head anytime soon.
Okay. Get my old lady posture.
Yeah. Use that forward head for right now.
Don't use the arm too much.
I'm not going to use the arm. I think I was lifting so much debris from the plane and carrying people that it's so painful right now. It's numbness, tingling, a lot of pressure buildup.
I gotcha.
Okay. Cool. Well, I think we're close to the hospital. I'm taking you to Gray Sloan Memorial Hospital.
Okay.
They have the best.
Oh yeah. Okay. Good. Sounds good.
Miss Sue, I'm Christina Yang, and I'm good at my job. We're gonna take care of you. Okay. Just so you know, you're good from the plane crash. But there's something going on in your neck that we need to make sure we're taken care of.
Okay.
Residents, I need an MRI, MRA, a carotid ultrasound, and a cervical radiograph. Stat. Miss Sue, we just got your test back, and the MRA and the ultrasound of your neck show a 90% stenosis.
What's that mean?
So what the stenosis means is that only 10% of the blood is getting to your brain.
Oh,
because there's kind of a narrowing of the tubes in your neck.
Okay. Well, we gonna fix that?
Yes, I'm gonna go in there and I'm gonna fix the blood flow using an endarterectomy procedure.
Okay.
Whew. So there are some risks, of course, with any surgery, but I'm the best. So.
All right, you better fix me, ma'am. Okay, I'm trusting you. Okay.
Yes.
All right, you got this, Shug. You can do it.
I'm gonna do it.
Okay.
Thing. Scalpel. Oh no, we're losing the patient. What do? I need more gauze. Paddles. We have a rhythm. Beep, 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 beep. Okay. Ready to close?
Hey Sierra, I'm Dr. Torres. I just want to personally thank you for getting all those victims in from that plane crash. That was so heroic. Sorry your surgery got pushed back a little bit for your fasciotomy. Do you have any symptoms right now?
It definitely got acted up when I was moving so much of the plane debris. I was getting the paresthesia and not being able to really move my fingers much.
Okay.
But it's been a few hours now, so it's calmed down.
Okay. Well, we'll go ahead and get that fasciotomy done and kind of clear everything up, and hopefully you won't have any symptoms anymore. Okay?
Yes, thank you.
All right. All right. Opening. Nice blood flow. I might have put the median nerve. Let's test the nerve out. Okay, her finger's still working. Alright, good. Get a good release and open everything up. How's her heart rate doing?
Heart rate is steady.
Okay, good. Let's put some mesh on it. Hand me the mesh.
Oh no, we're losing her.
Okay. Starting compressions.
Okay, we got a rhythm.
Okay, good. Alright, let's put the mesh on and get her out of here.
Okay, well, I guess I'm taking us back to the airport.
Oh, yeah,
It's been a long few days.
it has. And I'm glad our surgeries went well. Sure. I think it might have been close there a few times with us.
Yeah, I think it was an immediate thing. We had to get you to the hospital.
And your arm, it looks a lot better. It ain't big like it was. That's a good thing.
Yeah, they said that was from 15 millimeters per mercury up to 30 right before they did the surgery.
Oh, wow.
So it was bad.
I don't know what that means, but it don't sound too good, so I believe you.
Yeah, I think, I think we're gonna be better off now. That plane crash, and we've put it all behind us.
Yeah, well, thank you. I'm so glad I got to sit beside you and you took care of me. I really appreciate that. Now,
I'm glad we met, Miss Sue.
Yep, it was nice meeting you, Sierra. Thank you so much. I'll have to email that PT, McKnight, and tell him I'm good now. I don't need him, and he should hire you up next. I'm telling him
That would be great. I graduate in 2019.
Okay, cool. Oh, you almost there. You almost there. Keep going, Suge. You got it. All right.
Off into the sunset.
Name the 5 D's and 3 N's.
Residents, what are 3 of the 5 telltale signs of compartment syndrome?
Name 4 symptoms of VBI.
How much will the muscle expand in a percentage?
Name 4 risk factors for VBI.
Residents, name 2 causes of compartment syndrome.
What is the most common cause of VBI?
What are 3 diagnostic tools used to diagnose compartment syndrome?
What are the 3 test positions for vertebral artery testing? To the girl who saved my life. This is just the best token I could think to give you. It's not even worth it. Once I returned back from my trip, I looked up what VBI is and I realized how serious it could have been. I was so close to having a stroke or even worse. So here's just a generous token of my appreciation, and I just ask that you use it wisely. I know you're in PT school, and I just hope that you'll be able to open up your own clinic and pay off your loans when you graduate. Again, it was so nice to meet you, and thank you so much. You don't know how much it means to me. Sincerely, Betty Sue.
School loan, water bill, school loan. A card from Miss Betty Sue. Gosh, I haven't heard from her in years. Maybe it's a graduation card. Oh my gosh, Miss Betty Sue died? But she gave me a check for $5 million? But I don't understand. To the girl that saved my life on the plane, use it wisely. She wants me to open a PT clinic. $5 million. Oh my gosh, Miss Betty Sue. She was a nice lady. Thanks, Betty. I just can't believe this. Oh my gosh, $5 million. I could do a lot of good with this. Thanks, Betty Sue.